America, Africa, and Asia. And here we're looking at migration management during the COVID-19 pandemic. And as Dr. Sada has put it, the panel is very, very, very diverse. And I think you can fasten your seatbelts for this, because they will also take us through not just a journey through migration management, but also a journey through the various continents. If you're joining us from Latin America, good morning. If you're joining us from Africa or Europe, it's good afternoon. And for those of us in Asia, some of us even had our dinner already. So looking forward to this discussion. Without much further ado, I think I would just, add a few points that Dr. Sada has put. Since it is the 14th panel discussion, we have had such a wealth of information in the last 13 sessions. And, but the COVID-19 pandemic doesn't seem to leave us. The deeper and deeper we get into these discussions, the deeper and deeper we get into other areas that COVID-19 is impacting on our lives. We do know that no country has been left untouched or unaffected. And therefore, global, national, and international systems, as well as structures, are overwhelmed at this moment, and global solutions, national solutions, as well as local solutions is what governments seek to find in order to deal with the negative consequences of COVID-19 on their economies and livelihoods of its people, whether they are home or they are abroad. So far today, I think I was looking at the numbers, we're already at 16.5 million of COVID of the caseload at the global level, and 650,000 deaths. Some countries experience more deaths. Some countries have experienced less new infections. We're in also a period of a second wave, and therefore I think it's very timely for us to talk about how best migration may be managed by government working together with its various stakeholders as a whole of society and a whole of approach system in order to curb the impact that COVID-19 would have on migrants and their livelihoods. Closed borders are reclosing. One day you hear it's closed, another day you have a new standard operating procedure of how things will work. And then the next, like has happened in Hong Kong, for instance, borders are beginning to squeeze down again. And therefore the new normal for us is wearing masks. I think we are privileged that we're on an online platform. Otherwise in a physical room, we would all be in masks of sorts. Just checking if everything is okay. Okay, yes. At the same time, we also know that national responses have included stimulus packages that try to cater for an audience, but it can never reach the wider audience. And here we're talking about migrants and, for instance, people who work in the informal sector who would usually be left out of these stimulus packages, if at all touched. Health systems are under constraint, and governments together with various partners are trying to understand how best health systems could be opened up to include also migrants. And therefore there's so many different measures happening at the national level, maybe even pushed through regional mechanisms and international organizations trying to get a grip on this impact of COVID-19. And therefore this discussion couldn't have been more timely, and the fact that we travel through the various continents also is also not an accident. We have a very diverse panel, like I mentioned, but we also know that in the room we have quite a number of experts from various fields as well who will be able to contribute to this discussion, and we're looking forward to that. Maybe just a bit of housekeeping before we will go into our presentations. I will just ask everybody to mute your mics, even though I know this is being done centrally. It's better that you keep your mic off. We do have a Q&A tab there in the Zoom functionalities that you can press and put down your questions as the presenters are giving, because we will have an opportunity for us to ask questions to our presenters, and also for us to hear from the panelists, as well as the other experts that we have in the room. So without much further ado, if I may, I would just like to take you through a journey, and we will start in Latin America, since it's morning for them and they're very fresh with their coffees and teas. And I would like to introduce Dr. Marcia Vera Espinoza, I hope I've pronounced it correctly, and she is a lecturer in human geography at Queen Mary University of London. Her research in development, political, and social geography has a focus on migration in Latin America. And she, in her studies, she's particularly interested in looking at migration and refugee dynamics, and also understanding, experiences of inclusion as well as migration governance in Latin America. Before she joined Queen Mary University, she was an associate researcher within the European Research Council funded project that looked at prospects for international migration governance, and she taught at the University of Sheffield. She's currently conducting a study on the impacts of COVID on migrant and refugee populations across 7 countries in Latin America, as part of this research group that looks at sort of a comparative analysis on international migration and displacement in the Americas. So it's a wider study, and her study focuses particularly on Latin America. And I'm excited to say that we are a privileged audience, as we will hear some of the preliminary findings and reflections from this ongoing research across 7 Latin American countries. And then she will really zoom on the institutional responses and the role of key actors. So please have your pens, or is it keypads ready to shoot down all those questions that you have been storing up with regard to migration management in Latin America. Dr. Marcia, if I just invite you to give your presentation. Thank you.
Thank you so much, Patty, and thank you everybody for joining us today, wherever you are. I would like to thank as well the colleagues of the Global Research Forum on Diaspora and Transnationalism for the invitation and for organizing this cross-regional dialogue. It's really exciting to present alongside colleagues analyzing the impacts of COVID-19 and migrant and refugee populations across Latin America, Africa, and Asia. Really a welcome dialogue. So I'm very happy to be with you today here. Today, we'd like to share, as Patty mentioned, some initial findings from the ongoing research that we are conducting with colleagues across 7 institutions in Latin America as part of our research group, CAMINAR. This is Comparative Analysis on International Migration and Displacement in the Americas. And as part of this project, we are exploring the impacts of COVID-19 in migrant refugee population in Colombia, Peru, Ecuador, Chile, Brazil, Uruguay, and Mexico. So we're speaking in particular about these findings, but I know that my colleague Leisa Brumat, that also is a specialist in the region, will allow us to contextualize this as well in different ways. So you will see a lot of crossovers between mine and Leisa's presentation as we also work along together in many projects as well. Now, to put a little bit in context, when we think about the crisis of COVID-19, this crisis hit Latin America in the midst of 2 major displacement crises. So we have in one hand that over 5 million Venezuelan citizens have been forced to migrate mainly to other South American destinations over the past 5 years. Mexico, on the other hand, has been grappling with the transmigration and increasing settlement of hundreds of thousands of Central American migrants as a result of the externalization of border and asylum procedures by the United States. Suddenly, what we had is that these key countries of the region turned from being sending into transit, but mainly destination countries. In the context of rising xenophobia and limited state capacity, migrants and refugees have been excluded from most of the emergency responses to the COVID-19, particularly those ones that are in irregular situation, either structurally or in practice. Indeed, a review authored by our research team concluded that the COVID-19 crisis has deepened the vulnerabilities faced by this displaced population, for which there has been very little in the form of targeted interventions by the different governments in the region. Now, as part of our research, so far since the beginning of May, we have conducted 70 interviews with officials of national and local governments in the main cities and transit cities across these 7 countries. We also interview NGOs, migrant-led organizations, and also international organizations. All key informants have confirmed that the COVID-19 indeed has increased and exacerbated some conditions of precarity or vulnerability of the mobile population in Latin America, given the high rates of job informality and job insecurity, overcrowded living conditions, and in some cases, limited access to health service and social protection, which varies across the region. These multiple determinants of vulnerability, mediated by the intersectionality of age, sex, and also race, means that the migrant and refugee populations are not only more vulnerable to the risk associated with the COVID-19 virus, but that the different levels of inclusion in governmental responses to the crisis have also deepened pre-existing inequalities and gaps between the migrant and the national populations. So then what we have in Latin America is a double crisis, one of the increasing displacement flows, not only of Venezuelan and Central Americans, but also of Haitians and Colombian, among other groups. But also we have the one of the COVID-19 sanitary crisis. Latin American historic social and economic inequality and high rates of labor informality poses an extra layer of complexity to the government's ability to effectively deal with the crisis within the crisis. I would like to briefly outline here 5 initial ideas that emerged from our research and that can contribute to this debate. One is the one of mobility within immobility. The pandemic, as in many regions across the world, is reshaping already changing mobility dynamics and producing new migration patterns with attendant drivers and consequences, what we call a sort of mobility in immobility. In particular, the unprecedented context of border restriction and pandemic migration measures have provoked 2 distinct movements, one the return and the other one of forced immobility. On the one hand, the exacerbation of migrants' already precarious living conditions have led to many to take the extraordinary bottom-up actions to guarantee their livelihoods, leading to mass returns, many of them by foot, to their countries of origin or emigrate to other places, either nationally or internationally. On the other hand, the region has witnessed reinforced patterns of involuntary and forced immobility that is propitiated by top-down measures, such as the increased express deportations, often without due process, and by the limitations on cross-border movements and the ability to seek international protection imposed by border closures. Examples abound. Bolivian and Peruvian migrants, for example, labor migrants. In Chile, they were some of the first ones to start their journey back to their countries when the lockdown measures started. Unable to return home because of the border closures, they stay in the border cities in the case of Chile, which represented a new risk because there was a lot of people congregating together outside the consulates looking for an opportunity to move back to their countries. But then on the other hand, we have the situation, what is happening in the case of Central American migrants, that through the migrant protection protocols known as the Remain in Mexico program, the agreement that enables the United States to send non-Mexican asylum seekers back to Mexico to wait for the immigration proceedings, is also having very dire consequences. Due to the current suspension of the program, more than 15,000 asylum seekers, mostly from Central America, are trapped in 11 border cities in Mexico. So basically, increasingly, Mexico is becoming a destination country as well. Second point, the pandemic has emphasized, and this is quite important when we're looking at responses, the key role that the local has within migration governance. In many countries in Latin America, across the 7 countries that we are researching, we can see that the municipalities are the ones that have better responded to the needs of migrant and refugee populations, as they have prepared shelter accommodations for those groups that they were trying to go back home, that they are provide food parcels to the ones that are in dire situation because of the pandemic, and they also have included migrant and refugee population into their own social programs by also liaising directly with the NGOs and migrant organizations. So really the municipalities are the ones that we have to emphasize here. Third, through our interview, we have explored some of the consequences of border closures in the short and long term. For example, of how they change the migration procedures in these countries. For example, one of the trends that we have seen is the sudden and accelerated digitalization of migration procedures, as is the case of Chile, Peru, and Uruguay, in order to avoid people going to process their visas or documentation to the main offices. While some of these developments are welcome in terms of digitalization, there's still a lack of evaluation of how it's working so far. Initial assessments provided by civil society and migrant organizations through our research claim that the digitalization of procedures hasn't reduced waiting times. In many cases, have extended and prolonged the waiting times. That not all procedures are included, and also that in many cases, there are not alternatives measures taken when there is a lack of digital literacy or there's people that doesn't have access to internet data. There are some welcome developments in relation to, for example, some temporal extensions to the expired date of certain IDs or visa documents, as been the case of Peru, Colombia, or Chile, for example. However, we see a worsened situation when we talk about asylum. And this is because most of asylum procedures in Latin America, as many countries in the world, require an initial interview. And because there's a lack of face-to-face contact, those interviews in many cases are not taking place, which means that thousands of people across the region are being unable to claim asylum or are right now in an irregular situation. What is clear, as some of our interviewees have said, more border restrictions don't stop migration, but instead increase migrant irregularity. The mobility going in and out of the countries of the region continues, as many opt to the last resort to use unauthorized border crossings. Fourth point, many NGOs, migrant-led organizations, and international organizations have to quickly react and redirection their own budgets and plans to make, be able to confront the crisis. So they had to adapt their planning programs quite quickly. Not only international organizations, we see this in the case of the UNHCR, the IOM, but we see it as well in the case of NGOs and migrant-led organizations. They have to work with each other as well as with local governments in order to provide food parcels, food vouchers, to create some cash-in-hand interventions to cover these increasing needs. There's questions that emerge here about the role of these organizations and how permanent this sense of emergency is going to be. My fifth and last point to bring to this conversation. In many of the countries we analyze, there has been reports of increasing xenophobia and discrimination against migrants as governments, in many cases, the media, and society at large tend to relate COVID-19 and associate COVID-19 with irregular migration. We can see an increasing campaign in this regard, even when in many cases it wasn't irregular migration the one that brought to the virus in the first place. Despite this difficult regional scenario, we also have seen some specific acts of solidarity among host and migrant communities. Even what is more relevant, and here when we're talking about good practices, is also emphasize the good actors, has been the support and the role in Latin America of migrant-led organizations. No pro-migrant organization, actually migrant-led organizations that with limited budget and limited human capital have done enormous efforts to cover basic needs when they can, but also to continue with the awareness campaign and to make sure to keep migrant communities informed about the changing sanitary measures by translating information in different languages through the social media and WhatsApp campaigns or different formats. Now, beyond these initial 5 points remains the question of how COVID-19 is changing migration dynamics in Latin America and the experiences of migrants and refugees, but also how migration governance is changing in the region. Governments across the region have overwhelmingly responded to the displacement fluxes of the last 5 years as temporal contingency, adopting a series of ad hoc measures that reinforce displacement as an emergency issue. The emergency response to COVID-19 then reinforces and pushes to think about this idea of the crisis within the crisis. As we have to think how we move forward from the emergency, particularly we have to be thinking about how this response of the emergency within the emergency is changing the prospects of inclusion and integration in Latin America. As we know, migrants have been an key to the efforts to mitigate the virus, and they will also be key in the recovery process. Including them now in the government responses, as well as including all these other key actors that are emerging, will facilitate these efforts. but also will contribute to reduce the gaps between migrant and native populations now, but also in the post-pandemic. And I will leave it there. Thank you, Patty.
Dr. Marcia, we can listen to you all day because I think that there's so much to unpack in that study covering those 7 countries, but I think also understanding a bit more of what's happening at the regional level. I like the part where you really bring out the fact that migrant-led organizations have really been in the forefront. I think this is something that other regions, other governments can pick up in terms of leveraging support. But I think it also ties in very well with the presentation of our next speaker in seeing how migrant-led organizations are able and also looking at how there's solidarity among host communities, even dealing with things like increased xenophobia and how they react to it, pertaining to how state authorities react to it. So without much further ado, let me just introduce our next speaker, Dr. Leiza Brumat, who is an international relations analyst. She's currently a research fellow in the Migration Policy Center of the European University Institute in Florence in Italy. And before she joined MPC, she was a lecturer in international relations, regional integration, as well as international organizations, and a research fellow for what is known as the National Council of Scientific and Technical Research, that is based in Argentina. She was awarded a PhD in social sciences by the Flaxo, if I've said it right, Argentina, with a thesis that focused on free movement of persons in Mercosur. And I think catching up with the previous speaker, with Dr. Marcia, I think there will be quite some interlinks on this and seeing how governments have managed to handle it, because her presentation is really going to the political responses to COVID and their effects on mobility in South America. Leiza, do we have you in the room?
Hello?
Hello, welcome.
Thank you very much. Well, thank you very much, Patty. Let me see if I can share this screen with you. Okay, because I have a PowerPoint presentation, can you see it?
Yes, we can see it, thank you.
Yes. Great. So, first and foremost, thank you very much to the Global Research Forum on Diaspora and Transnationalism for inviting me to this super interesting event with such a global perspective. I'm really excited to share this presentation with other colleagues from many regions, also in the Global South. And you will see now that in my presentation I address some shared issues that maybe we can further later on discuss and develop upon. This presentation, and hello to everyone in the different time zones as well. Okay, this presentation will focus on the political responses to COVID-19 and their effects on mobility in South America. So you will see it is very much complementary with the one that Marcia just did. As it touches upon, I will try to provide a general perspective of the responses of how countries are handling the COVID-19 crisis and how this affects mobility. So I will basically focus on how the COVID-19 crisis is affecting mobility in countries in South America and the political responses to the pandemic. So why am I focusing on South America and not Latin America? As you can see the maps of both regions. First and foremost, because South America is mainly a region of intra-regional migration. That is, most migrants of South Americans move within South America. This is not the case for Mexico and Central America, which is mainly a region of extra-regional migration. This may change because of the tendencies that Marcia has just mentioned, but in general terms, this is the case. Also, South America shares many interdependencies and regional dynamics that has led the region to develop many regional organizations to deal with these shared problems. And I will talk about these regional organizations right now. I would like to begin by telling you a little bit about the context in which the pandemic hit South America. If we remember a little bit, just half a year ago, not so long ago, there were massive social protests in many countries around the world, with the epicenter in some South American countries, particularly in Chile, which then spread to many other South American countries. So there was social unrest in many South American countries. At the same time, there is a very deep and extreme crisis, one of the worst global crises in Venezuela, which is multidimensional. It affects the economy, the society, and politics in Venezuela. And this has led to the largest forced migration flows in the history of South America. This is very important to note that more than 95% of these Venezuelan migrants are going right now to other South American countries. They are not going to Europe, they're not going to the States, they are going to other South American countries. At the same time, there is an economic crisis, very deep recession in almost entire region, but particularly in the two largest economies, Argentina and Brazil. And also at the same time, these countries were already dealing with their own epidemics, such as dengue fever or measles in Venezuela. What I want to say with this is that the pandemic hit South America at a very bad moment, and it will likely make all these problems worse, and it has limited the options of the countries, of the governments, to deal with such a deep crisis. I will address these policy responses in three levels. There have been regional responses, national, subnational responses. At the regional level, countries have tried to coordinate common responses. For instance, border closures are coordinated at the regional level, but there's something very interesting. In South America, there are many cities that are binational. So there is a city that is divided by two countries. There is the same urban space that belongs to two countries. Countries have decided regionally not to close the border, not to divide the city in two, but to do these border closures outside of these binational spaces. So the regional level has served for this, for instance. But on the downside, there was a regional organization that was called UNASUR that was abandoned by most of its members in the last few years. And UNASUR right now would be very useful because it had developed a lot of regional policies and regional cooperation in the area of health. So it's the fact that UNASUR is not really working anymore is very much felt right now. At the national level, as you can see in that very colorful map, the national responses to the COVID-19 crisis have been very, very diverse in the entire region. So we have some countries such as Brazil, absolutely privileging the economy, and other countries such as Uruguay, privileging or adopting a more society-oriented approach. Uruguay, by the way, is the case country of the success so far in managing the COVID-19 crisis, and I will further on say a little bit more about that. But countries have adopted a more or less harsh response to enforcing mobility on mobility, but there are some countries that have militarized immobility. So adding to what Marcia just said, some countries have militarized the borders or even the streets to enforce the quarantines and the curfews that have been adopted. So some nationals or some countries are not being able to enter their own home countries, and there are many allegations of police abuse in many countries going on right now. But now going to a sub-regional and local levels, we can see that the varieties of the responses are enormous. And they can really be even contradictory with what the national level says. For instance, there are some closed borders within countries. This has led to the paradoxical situation in which there are some citizens that are stuck within their own countries and at the borders between one province or department and the other. And this has been going on for months already because South American countries, many countries have been in quarantine or in lockdowns for 3 to 4 months at this point. There are some other very curious ways of addressing the lockdowns as well. One example of this is Santiago de Chile. Santiago de Chile had adopted at the beginning a municipality-based lockdown. They basically, the lockdowns were based on every neighborhood. So maybe you are living in a neighborhood that was under lockdown, very strict one, and 5 streets away there was no lockdown. Well, that model didn't work, but right now Bogotá in Colombia is adopting it. Also, the responses have varied a lot depending on the type of organization of the country. So a very federal state like Brazil had saw very different types of political responses to this. There are some states, particularly the most powerful ones and richest ones, such as Rio and São Paulo, openly contradicting the president and enforcing their own lockdowns. And something very important, and I would like to add to this, to what Marcia said about the vulnerability, is that, as she mentioned, more than 50% of the economy of the region is in the informal market. This leads to a large part of the population not being able to live without moving. So mobility is a basic necessity for subsistence. So the neighborhoods in which these people live are enforcing their own types of organization, their own quarantines, and their own ways of providing basic resources and food for people. And even organizations, as Marcia mentioned, NGOs are playing a crucial role in this, in enforcing these quarantines, this type of policies, and staying in your neighborhood and not staying in your homes because it's not possible, staying in your neighborhood type of policy. But at the same time, there are some cases in which some slums are being even closed by the militaries. This is an example, for instance, it happened with Santa Cruz, a neighborhood outside Medellin in Colombia, but in many other neighborhoods as well in the region. As Marcia mentioned as well, this is all these responses together with the rising economic crisis is leading to new types of mobility and immobility, as Marcia said. One of these important types of mobility is a trend, increasing trend of return migration. There are some estimates, we don't really know the exact numbers, but there are some estimates that around 50 to maybe 100,000 Venezuelans have already gone back to Venezuela in a very extreme and precarious situation, and doing very long trips, as Marcia said, and thus increasing, without safety conditions, thus increasing the possibilities of contagion of COVID-19. At the same time, and as people can no longer afford to stay in their cities where they are living, people are going back to their houses in Venezuela, in other countries, or even in rural areas. So they are taking buses or just walking back to rural areas because they can no longer afford where they live, to stay where they live. So to sum up, at the regional level, the responses are limited and coordination is not that developed. And there are many restrictions to mobility. We have to understand these restrictions to mobility at the national, subnational, very, very local levels. Some countries have militarized the streets and borders to enforce mobility. And paradoxically, there is more mobility or new types of mobility, such as return migration, because immobility is not a feasible option. So we have to look at the responses, we need to look at the responses of these countries with the current local capabilities and resources and increasing problems to address. Thank you, gracias.
Thank you. Thank you, Leysa, for that very insightful look into not just understanding what's happening at the national level, but also, you know, zooming down to the local level. And even in some cases, it seems as though when the local level doesn't agree with what the state would say, they're able to push through their efforts. So I think there's some important lessons to be drawn from there. And particularly also understanding how lockdowns have affected people's mobility, and this concept that you have repeated that sort of looks at immobility within mobility, right? Isn't it? So it's, yeah. I think that at this point, we'd just like to recognize some of the experts that are in the room, and then I will ask maybe two of them to give us a word or two within 1 or 2 minutes following what has been presented on Latin America. But just to recognize the presence of Dr. Didar Singh, recognizing the presence of Professor Andrew Geddes, Professor Brahim Maharaj, Professor Bhatt is in the room with us, Professor Pushpendra Kumar, you're welcome. Dr. Raj is here with us as well. And Professor Binod Kadria is also with us. And I would just ask if Professor Andrew is able to say 1 or 2 words, followed by Dr. Didar Singh. Dr. Didar Singh? Okay. Professor Andrew? Okay, maybe we can ask, is Professor Binod Kadria Can you hear us? Are you able to just share a bit of your reflections on the last two presentations?
Okay. Unmuted. Yeah. Thank you, Paddy. Both the presentations have been fascinating, and particularly because as the trend itself reflects that most of the migration in South America or Latin America is intra-regional, and so is our knowledge about that continent. As if that continent is not part of this world. You know, we are so ignorant, and that actually makes these two presentations so much more important for us to understand. But having said that, what dawns on me is the fact that we share the same experiences, the kind of experiences that have been mentioned, particularly with respect to the rural-urban or urban-rural migration, the immobility, the militarization. All these are experienced within India also. And say the inter-province migration that has been, the exit itself has been stopped by some of the provinces, some of the states. So that, I think, is something which is very, very important. At the same time, I would like to try to understand the role of migrants, particularly what is happening here. Just a minute, I was making some notes. Is that in Europe, I wish that our colleague from Europe would have been present here, but we had the speaker. What I find that there is a new initiative in European Union now to invite migrants to be part of an expert committee. And that, I think, is a new initiative to listen to the migrants' voices in terms of what could be done. Also, another point that came up is the role of the municipalities, which is very, very important. And I find a contradiction in the case of India when it came to interstate migration right at the beginning, in the month of, say, end of March and April, when the lockdowns were just announced. There was massive exodus from urban India to the rural areas, and that was totally mismanaged in the sense that there were no arrangements at all. And that is when we find that the states in India were behaving like, like independent countries. And that's where the federal system of India came under question. And if that is so, my take would be that if we are going to see empowerment of the states, which is a good thing, it has to trickle down. That empowerment has to trickle down to all the way to the districts, to the blocks, and what is in India called the panchayats at the village level. That unfortunately has not happened. And you find that there is now, that is something very, very important, because as they say, calamity does not come alone. And in India, you will see so many other things that are happening. The Northeast is now going through massive, and Bihar also, the state of Bihar and Assam are experiencing unprecedented floods, and lots of people are experiencing death. So it is correct that when we talk about other epidemics like dengue and all that has been mentioned here, we have to take that also into account in terms of what are the causes of death. And I was listening to a professor yesterday who was sharing the information that some of the countries, say for example Ethiopia in Africa, the death per million was very, very low in these countries. Sri Lanka, it was low. In Asian countries, it was low. And the professor was wondering why it is so. And although it was, it was a large crowd, so the question that I put was not noticed. But my take on that was that if we think of a country like Ethiopia, then the marginal death because of the COVID perhaps is very, very low. But the death for other regions, starvation, for example, could have been higher. And that's why we find that the incidence of deaths due to COVID could be low, and that we should not be underestimating that, because it's a pandemic which is going to make it worse for those who are already suffering from other kinds of illness or other kinds of deprivation. Thank you very much.
Thank you very much. Thank you very much for that reflection. I'm told Dr. Didar Singh is with us in the room. If you can just do it within a minute before we move to the next segment, just to give us your reflection. Thank you, sir. Okay. I think that then it's time for us to take the trip from Latin America to where the sun has been shining for a little while, because they're probably past their lunchtime, and we will go now to Africa. And there we have two presentations. The first presenter is Dr. Faizo Gabar, who is a lecturer in the Department of Sociology at the University of Cape Town in South Africa. His research and teaching interests go around African migration, social change, working class history and organization, as well as looking at African historical sociology and social theory. And Dr. Gabar, are you here with us?
Yes, I'm here, Paddy.
Okay, and then I would just ask Dr. Gabar to go directly into the presentation, and you have 7 minutes for it. Thank you very much.
Thank you, Paddy, and thank you, everyone. Greetings. Unfortunately, we are in winter in South Africa, so the sun isn't shining. It is a privilege to be on this platform and to share lessons about things happening on the continent. Now, apart from a few countries across Africa, borders are still closed, although restrictions have been eased differentially across states. Now, the reality, though, is that states are increasingly adopting a very nationalistic posture in dealing with COVID. Relief packages are distributed as if COVID only affects citizens. And for example, in Ghana, which is where I come from, my country, the states actually threatened at the beginning of the pandemic to deport non-citizens who test positive for COVID. Luckily, no such thing has happened so far. But what COVID has done on the continent is to exacerbate an important issue, which is who belongs to society, to whom does the society belong. The lines of demarcation have become sharper, especially with state action. Just like in Latin America, the bulk of migration in Africa actually happens within the continent, and in particular within what we call the sub-region. So the bulk of people from West Africa move within West Africa, the bulk of people from Southern Africa move within Southern Africa, same with the other sub-regions. Now, migration in Africa is a historical underpinning of livelihood structures, but also ways of living. People's identities are very much tied into the space that they consider as their horizon. But over time, states in Africa have adopted a very restrictive understanding of migration and what it means for people to move. However, attempts at regional integration have led to a situation whereby protocols have been put in place that enable people from sub-regions, say West Africa, to move within the sub-region for a particular point of time, and also in Southern Africa and other parts of the continent. Now, my presentation will largely focus on Southern Africa and South Africa in particular, and then a few instances in East Africa and North Africa. And what I want to highlight here is the importance of grassroots forms of solidarity as best practices. How in moments of this magnitude, we actually see the opposite of exclusion. We see outlines of a different kind of society that ordinary people have extended towards each other. South Africa is the major point of migration in Southern Africa, but also across the continent, really. You have people from every part of the continent in large numbers in South Africa. The states, as I said, has adopted a very restrictive outlook towards migration. At the beginning of May, the states rolled out a fairly generous relief package, to cushion people who've lost jobs, people who have lost their means of livelihood. But the relief package was expressly formulated to cater for citizens. And so refugees, asylum seekers, and stateless persons were completely excluded. But two civil society groups took the state to court and actually won a case that forced the state to extend the relief package to refugees. Now, this was a moment in which many refugees and asylum seekers were actually going through the most in terms of lack of access to basic necessities, but also when it comes to the important question of access to healthcare, because there is a certain element of the testing requirement that demands that people have national identification numbers, which effectively, shut out people who are not citizens from being tested. So as if the virus, discriminates based on citizenship status. There have also been community-based initiatives, especially in the informal settlements, where, many migrants, many working class migrants, so people come together to try and extend support to each other. People come together to try and take care of each other when they fall ill. And this crosses nationality boundaries. This is between South Africans and non-South Africans. And this is important, especially in South Africa, where, as I'm sure we all know, you have this occasional outbursts of xenophobic attacks targeted largely at working class migrants from other parts of the continent. So it's important to have this kind of pushback against exclusion, which is largely driven by the state. Sometime in June, there was a poster that was doing the round across the country, basically saying, on this day, we're going to make sure we kick all the foreigners out of our country, right? But there was a huge counter mobilization in communities, by civil society organizations, a major movement in South Africa called Abahlali Basamanjondolo, which is the shack dwellers movement, release a powerful statement, calling for an inclusive policy that ropes in everybody who lives in South Africa in the fight against COVID. And I think that is an instance where one sees a bottom-up approach, to thinking or managing migration, which completely contradicts the exclusionary outlook of states. There are also, initiatives, one of which I'm part of, it's called the South Africa Migrant Solidarity Fund, which basically tries to extend some form of support to female-headed households. It isn't that much; it's about $16, but that could do something, So often, what we do is to get vouchers for one of the major retail outlets, and then people can go and get food items. In Kenya, for example, the Dadaab refugee camp saw a collaboration between the Kenyan state and the UNHCR to create an isolation and quarantine center, but also the construction of close to 1,000-bed facility to take care of people who fall ill. And what I find interesting is a refugee-led working group, that produces face masks. So far it has produced close to 200,000 face masks. And I think this is also interesting in terms of the livelihood of those refugees, but also their active involvement in dealing with this, as opposed to being viewed as passive agents in this process. There's also an attempt to provide information on how to prevent COVID in Oromo, in Somali, in Dinka, Swahili, Nuer, French, and other languages. I think this integrative process is important because it begins to come to grips with the reality that the society is heterogeneous, right? Migration has brought people from across the continent, from even outside of the continent together. And so if one is thinking about tackling a disease of this nature, then one has to be inclusive as possible. The final example I want to give, which I think is really important in terms of access to education, is from Morocco, where again the UNHCR, some local organizations, and in partnership with the Ministry of Education in Morocco, try to facilitate online learning of refugee children, during the lockdown. Now, that is very important because across the continent, there's very little discussion about where is the place of migrants in this moment. How do refugees fare in this moment? What is the status of stateless people in this moment? So I'll stop here in the hope that I have not overshot my 7 minutes, and then we can have a conversation subsequently. Thank you very much.
Dr. Faizo Garba, thank you very much for that presentation. And indeed, we could ask you to give us even more. And I would have even been more selfish to say that I would have loved to hear more about what your reflections were on how Zambia is managing its migration, how they're faring on migration management. But I won't go that far because that's homeland. And instead, I would take us all the way up from Southern Africa, where Dr. Faizo has just given us some reflection, all the way up to West Africa. And just as I introduced, just checking if Amanda Bisong, if you can be ready to do the presentation. Let me just introduce Amanda. Ms. Amanda Bisong is a policy officer at the European Center for Development Policy Management based in the Netherlands, and she's a Nigerian national. She has a background in law and a master's degree in international law and economics from the World Trade Institute in Bern. And she also has a master in international trade policy and trade law from Lund University in Sweden. She's currently also pursuing her PhD on the topic of regional migration governance with a focus on West Africa at the Institute of Development Studies, the University of Nigeria in Nsukka. So Amanda will just take us through, I'm sure, a regional dimension, because one of the things I've connected with Amanda also trying to understand her work that she did previously before she moved on to the European Center at ECOWAS. So I'm sure we will be taken through a bit of a journey in there and she will share some insights. And after that, I will ask some of our panel, some of our experts to share some reflections. Amanda, over to you. Thank you.
Hi, Patty. Thank you very much for the introduction, and thanks again for inviting me to be a panelist in this webinar. It was interesting, the last webinar we had.
Some echo in your computer.
Oops.
Just mute one of the mics. Just mute one of the mics.
Maybe we are watching another video of same thing. So you have to stop something.
Can you hear me?
Now
we can hear you with a slight echo.
With an echo. I'm not sure why. Is the echo still there?
Or maybe you open two Zoom IDs. Maybe.
No, it's just one.
Okay. So then there is something, maybe video echo or something is happening.
Yeah.
Now I think it's okay now.
Is it better now? Okay, maybe I keep the video. I keep the video turned off.
I think without that headphone you can talk. It will come well. Maybe that is the problem.
Yeah. Okay.
Okay, go ahead.
Yeah. So thank you again for inviting me, and I think I'll just go straight to my presentation because I've lost a few seconds there already. So looking at best practices in West Africa on migration management, that's a bit difficult because, like Faisal already said, most of the borders in Africa, between African countries are shut. And so in West Africa, I think from April, the decision was made
still it is echoing. I think the headphone, if you can remove, it will be okay.
Okay.
Directly you can
you hear me?
Can
you hear me?
Yes, this is slightly better.
Okay. Yeah, so the decision was made in April to shut down all, to close down all the borders in ECOWAS, and for the first time, we had a complete restriction of movement in the region, which kind of put a stop to free movement of people in the region. However, we still had goods that were moving freely within the region, and given the trading conditions in the region, this meant that people also had to move with these goods. So while there was a complete restriction to movement, you still had mostly truck drivers and their mates able to move with essential products or essential goods in along trade and transport corridors in the region to ensure that the countries were able to get access to food supplies and access to essential access to essential goods. Also, because the region has previously experienced something similar, which of course cannot be compared to the corona pandemic, but the Ebola epidemic was quite intense in the region in 2014, 2015, and as a result of this, there was already a regional coordination response, health response, being led by the West Africa Health Organization and the West Africa CDC. As part of the lessons learned from the Ebola epidemic, they were able to come up with standard operating procedures and guidelines for to ensure movement still within the region during the event of any epidemic. So these regulations and guidelines, which were adopted in last year, in December last year, were quite useful in helping the region to adjust to the shutdown of movement and shutdown of trade as a result of the pandemic. So one thing we saw in the region was that there were identified logistics and trade corridors in the region, and so there was, of course, a flow of essential goods along these corridors. And this also created opportunities for businesses involved in e-commerce and opportunities for businesses involved in electronic financial services. Yeah, and another thing that we saw as a result of the COVID pandemic in the region was that WAHO and CDC, in coordinating their responses, were able to get essential services from one part of the region to another. So some countries in the region have had their number of health workers in these countries reduced as a result of the Ebola epidemic. So for countries like Liberia and Sierra Leone, they already had lost a significant health workforce because of the Ebola pandemic. And so West Africa CDC and WAHO were able to engage in capacity building and also move essential health workers from some countries in the region to these countries to assist them in dealing with cases of the pandemic. Another case was Guinea-Bissau, where there was an increase in the number of infected persons as a result of increased testing. So the regional response has mostly been led by WAHO and by West Africa CDC. And what they've done also in the standard operating procedures and the guidelines that they have is to identify processes or procedures that immigration officers and customs officers can use at the border and at all entry points in the region to ensure that safety procedures, health and safety procedures are being undertaken, but to also ensure that economic activities are not stalled as a result of the restrictions. So it was kind of a combined approach, combining a public health approach with the economic approach. I think also another important part had to do with another important issue with migration management in West Africa had to do with refugees in the region, and mostly refugees that were moved to Niger as a result of the emergency transit mechanism. And these refugees now have, I mean, there are in the region. What we're seeing now is an increasing cases of social unrest, and in Niger we see that there are some unrest as a result of the presence of these refugees in Niger, when the social services are already quite constrained and are facing intense pressure. So what Marcia said about xenophobic feelings being on the rise, and also what Faisal mentioned about nationalistic tendencies, we're also seeing in several countries across the region with an emphasis on refugee communities. Now, most of the responses in the region have not made any reference to migrant workers or migrants living in these countries, especially as considering that the bulk of migration occurs within the region. I think this is a huge gap that has not been addressed yet by any of the countries in the region. So most migrants are basically left to fend for themselves, and they are not eligible to the welfare packages that are provided by the state. Hey, Paddy, are you there?
Yes, I'm here, Amanda.
Yeah.
Thank you for that reflection and that share. I was just when you compare notes between what's happening on the southern part of the continent and the western part, and I guess even those in the eastern Horn of Africa would also agree, is that governments haven't taken too much of a different approach in terms of not being so inclusive in the social protection packages that they are providing to the most vulnerable. And I think it has been a core that many civil society organizations on the continent, from different levels, from the local level, the international level, as well as the regional level, that's really pushing for governments to have a different view in how they look at vulnerability, and understanding that migrants are critical, a group in here. And like Dr. Faisal had mentioned, a bottom-up approach is very important in us trying to to deal with the adverse effects on these vulnerable groups. So I think some very valid points that you bring across. I also wanted to just reflecting on the fact that as Ebola was leaving the West African region, COVID was coming in, and there are some lessons that that could have been picked up even much more strongly, if one would say, since the Ebola pandemic had just been ending at the time, or even eradicated in some of the countries. So we did have some space to learn of how to handle our health systems, but how to look at vulnerability in a wider scale. Even though some of these lessons in terms of how Ebola was managed from a health crisis perspective have been used, obviously, in other areas within managing COVID as a health crisis. But then, just as we are leaving the African continent and about to cross over to Asia, I just wondered if we could just get a few reflections from some of the experts that we have in the room. I can see that We have Dr. Salio Dion. I don't know if you're still with us in the room. It would have been good to hear your reflections. We have had you before on this on these forum, giving us your take on from Senegal. So it would be interesting to hear what your additions would be to the two presentations that we had. And then at the same time, I have also asked, Ifeoma Nebeif to also just give us a reflection from her perspective, participating also from Nigeria, from the Department of English and Literature Studies in the Federal University in Taraba State. So just if we can have those two reflections, and then I will call upon another panelist speaker, and then we'll move over to the next section. Dr. Salio? Okay, Ifeoma, are you able to come? Are you able to come on? Okay, we try and move forward. Oh, I hear somebody.
Hello.
Yes, please go ahead. Maybe just increase your volume.
Sometimes unmuting is a problem. They can do it from their side.
Can you hear me?
Hello.
Yes.
Hello.
Hello.
Hello. Go ahead, please.
How are you doing?
Very well, thank you. You're welcome.
Okay, thank you for inviting me to this wonderful panel. I'm really very delighted after having listened to Amanda and all the panelists. I'm not going to add much about what Amanda has said. I think that the word that Amanda has used, which is very important, is how to combine economic issue, but also the disease itself. As you know, the African context is different from the other context that you have in Europe or that you have in Latin America. And our economy will not survive on what we can call a long lockdown. Then few West African countries apply what we call lockdown. But if we take the case of Senegal, we did not apply lockdown, but what we call self-down. Meaning those who could not really go out, they had to stay at home so that the economy could continue working, so that we're not going to have rates of unemployment or just a sort of reduction in the economic growth rate. Even if we all know that there is a cut in the economic growth rate, but having a negative cut in the economic growth rate would really cost a lot to the of West Africa. And so far, we can say that the world has a lot to learn from Africa, especially in the management of the pandemic, because of the experiences that African countries had over the years in managing epidemic, pandemic like smallpox, malaria, like Ebola. And we still know, I know that in our culture, one person dies, it's something important. Then we're not going to say it's not because a lot of people have not died yet, and then we don't have to expect a lot of people to die. But to what we see from picture we have now, we can see that I'm really managing. If we realize that we'll have organizations still warning, saying that things are going to get worse for Africa, but I see that African countries are really doing their best, and we hope that manage to kick off the pandemic out of Africa, out of the world, and then all the different activities will resume in some weeks to come or in some months to come.
Thank you, sir, for that reflection. I would just ask. Thank you. Dr. Raj, if you could just give your reflection. Dr. Raj? Okay, I think the plane is ready to take off. And also looking in the interest of time, I will now just take a journey into Asia. And I would like to introduce to you our next speaker. Mr. Amantha Pereira is currently pursuing a postgraduate research on online trauma threats faced by journalists and their impact at the Central Queensland's University in Melbourne. He has over 15 years of experience working as a journalist, and he works and his works have appeared in various press, including The Time, Reuters, The Guardian, and The Washington Post. And he works as a regional coordinator and trainer for the DART Center in Asia Pacific, in the Asia Pacific branch. Without much further ado, Amantha, I would just ask you to come and join us and give us your presentation.
Yep. Thank you very much. You can hear me clearly, right? Okay, and it's a very good morning, rather, from here. It's 1 o'clock in the morning in Melbourne. So, again, good morning. So, as Patty said, my background and my expertise is not on migrant workers. My expertise is on journalism, and my research is also on journalism. So I'll try to kind of bring my input into this through the perspective of someone who's worked as a journalist and also someone who's researching on journalism. But a little bit about the impact of COVID on Sri Lankan migrant workers. The impact is huge. Mid last month, the Sri Lankan government released data which said that around 1.5 million Sri Lankans were working overseas as migrant workers. Now, the number may pale in comparison to some other countries, but if you look at the population of Sri Lanka, that's about 1 in every 20 Sri Lankans, and that's a huge figure. And they also said that 40,000 Sri Lankans, at least, had lost their jobs and were trying to come back to the country. These were figures that were released mid last month. And this was at a time when the government was trying to repatriate these workers to Sri Lanka. The repatriation suddenly stopped because the numbers spiked in Sri Lanka, and the uptick in numbers was linked to returning migrant workers, to overseas Sri Lankans who were coming back to Sri Lanka and who were testing positive for COVID. So suddenly the repatriation stopped. This week, they have announced that it might start again, but we're looking at huge numbers if they are to bring them back into the country. Now, it's quite an ironic situation that these workers are facing in Sri Lanka. If you go back to November of last year, when the country was heading into an election, a presidential election, migrant workers who were returning to Sri Lanka just to cast their vote were feted as heroes who were coming back to the country to save the country from a certain disaster because they wanted to cast their vote. And you fast forward less than a year, now there is at least a perception in certain sections of media and in social media that they are not welcome. My colleague from South Africa spoke about this issue of who belongs. And right now, that's the situation that most migrant workers of Sri Lankan origin are grappling. Where do they belong to? Can they come back to the country? Even if they can come back, would they be welcome? And how would they be treated? And within the coverage of the migrant workers, what we've seen is that the media has been going after the sub-stories, the stories that attract the largest number of viewers or the largest number of clicks. So you don't get substance, but you get what is almost, and most of the time, tabloidish coverage. So you don't look at what's really happening. And because of this coverage, the important stories are missing out. And what's important is the impact migrant workers and the remittances that they're sending to the country are having on the economy. If you take as a whole, the remittances are the largest inflow of foreign currency into the country. And these are bulk influxes. And they come into the country, and it is about 7 billion US annually, probably more. And it makes up about 8% of the GDP. That's a big number. That is a big number. And what we are right now looking at is a huge reduction of these remittances. And on top of this, there's going to be reduction of tourism and other exports in the country. So there is going to be a cascading effect. And then if you go to ground level, the impact on poor households and probably lower middle income households is going to be terrible. Overall, about 8% of Sri Lanka's households depend on foreign remittances. And in certain parts of the country, especially in the north and the east, where which were the worst affected by the civil conflict, the number can go up to about 20%. So again, we are going to see the impact on these households. It's going to be really felt. Then another area that we are going to see this is that there is a large proportion of Sri Lankan females who go as domestic workers to the Gulf. And when they come back to the country, not only is the remittances that they send going to get dried up, they're going to form a portion of society which is going to be very vulnerable. But these stories are not getting reported, these stories are not coming out because everything is kind of now revolving in this fear psychosis. The pandemic is unprecedented. The impact of the pandemic is unprecedented. And on top of all that, within about probably 7 days to 8 days, Sri Lanka is going into another election. There's going to be a general election that's going to be held. So overall, what we are going to see right now is that the issues of the migrant workers are going to get sidelined. The numbers are too large that they cannot be repatriated effectively. And even if they're repatriated effectively, there aren't enough quarantine facilities to put all these returning migrant workers into so that they can go through the mandatory 14-day quarantine that the government has stipulated. Then the long-term impact on the economy is going to be really felt. And before I stop, just to come back to my core area, which is the media, what we are seeing is that there's a lack of awareness and also lack of skills within the media to cover these issues. Now, what's most important for someone like me is the lack of skills, that the Sri Lankan media is not skilled enough to identify the deeper issues in terms of migrant workers and their larger impact. What we see is stories that look at more like stuff that's coming out from movies or television series, where it's either really dramatically sad or it's at the other corner. It's really dramatically happy. But you don't see these quotidian issues being covered. And because of that, people don't have an understanding about the impact. And because of all these things combined, when we see the combined effect of the loss of remittances, of all these workers coming back, and large portion of a young population in the country unemployed, it will come as a sudden shock to the country because those issues are not being diverted into the public dialogue because the media's attention is somewhere else. Thank you very much.
Thank you very much, Amantha, for that insight into the migration management. Even though you do say you are not an expert on migration, I do think that you have shared some very important insights from your journalistic background into seeing how the issues filter through the media. I think your point on ensuring skills for journalists that cover these stories remain important, particularly as we look forward to whatever kind of a new normal looks that's coming up in the next couple of months, on how we are really changing that narrative to migration, because right now it doesn't seem to have the glorious picture that it actually does have, or let's just say that we're a bit selective as an audience and also as in general media in on how you portray the good sides of migration. So without much further ado, I would like to introduce the next speaker, Mr. Rafek Ravutha, who is the founder and executive, just a second, sorry about that. Hello, can you hear me? Okay, that's better. I'd just like to introduce Mr. Rafek Ravutha, who is the founder and executive director of CMIS. Mr. Rafek is investigating the cases of missing migrants as a media person, working as a rights activist for the past 20 years. Through his investigative television show, he's rescued and rehabilitated around 5,000 missing migrants in the last 20 years. His deep understanding about irregular migration channels, in-depth knowledge about the rules and regulations in the major countries of destination, as well as the constant support that his organization offers through volunteers, including advocates and rights activists at both the country of destination and home country, have been crucial to the activities of the organization. He represents his organization since 2007 in many different forums, and he is just here to share with us also from that perspective. I think it's always very interesting to hear from people that work directly with migrants themselves. I will just check to see.
Hello.
Mr. Ravutha, are you with us?
Yeah.
Okay, you can just go straight into your presentation. Thank you, sir.
Okay, thank you, Patty. Thank you. And thank you, GRFDT.
Hello, have we missed?
Please unmute. There is some, now it is okay, I think.
Is it okay?
Yes.
Okay. Sorry for showing up because my children are online classrooms, so we have network issues, so that's why. So I think hope you all are hearing me. Thanks for inviting me to share my experiences. And this was new to everyone, for us also, for the 2 decades of working in the field of migration and migrant rights issues. This was very new for us, for the civil society and the media. Media in the sense more than a media, it was, my program is actually supporting people to come across their issues and making a way to approach help mechanisms all around the world. That's the usual practice we are practicing for the last 2 decades. And this was, I said that this was new for everyone. So the we know that the pandemic actually was new to all countries, both sending and destination countries, and they were actually they were fighting with 2 things. One side they were fighting with COVID, spreading COVID issues, and the other side it was the existing lack of policies to prevent kind of things. So let me share some experience of civil society perspective more than government side, because I think I am the only one among these panelists to talk about more about how this situation was not overcome fully, but how we came through this situation. As you all know that after starting it from China, then to Italy, the first Asian country was Philippines to announce strict lockdown measures and for full containment immediately. After that, the next country was from Asia was Malaysia, to enforce the lockdown through movement confinement order. So it was actually it was just stopping spreading this pandemic to the others, because large number of migrant workers are there, and they were making sure that it will not make big issues for the country itself, for the locals also. And these two policy decisions actually widespread impact in South Asian countries such as India, Pakistan, Nepal, Bangladesh, and also a nationwide lockdown for just after this Malaysia, Italy, and China and Philippines. Simultaneously, Gulf countries also followed up this lockdown, because of they were hosting around more than 70% of their workforce from all around the world, and the countries in Asia region had two kind of strategies from second week of March. The first strategy was to mitigate the virus through lockdown and provide testing and quarantine facilities for the people. Secondly, they took a strategy to develop policies to deal with the health and economic impact of the crisis. The repatriation of migrant workers from workplace were completely ignored actually. The embassies, home, and host country governments delayed their response. That was the major challenge we faced during this litigation, this pandemic situation, because loads of panic news were spreading everywhere. You know that even from my place is Kerala, a small state in southern part of India, and we were having around 3.5 million alone in Gulf, and there were several news spreading out everywhere that this is going to this is going to affect workers who were settled in big labor camps around. So it was a big panic situation, and that time it was it was very big challenge for us to overcome that situation, to clear out, console the people, console the workers about that we have to face this challenge and we have to stay back where you are staying. So it was actually well received by the workers. So the major, my partners, they are centrally located in all GCC countries. They were spreading this news through WhatsApp groups and other social media to reach out people, because lockdown was declared and the workers were in a panic situation. And the government's side, from government side also, and the missions also started to reach out people through this organization. That was a good episode of this situation when it started. And technology was actually helped a lot in Asia. Mainly, you know that the Korean experience of starting Corona 100 application, and it was a good initiative from Korea, and it was the kind of but in our region it was more social network, social media through Facebook, WhatsApp, and the other social network platforms, civil society organization, and as well as government and the missions also. I know that most of the Indian missions in GCC countries done webinars and video conferences for reach out diaspora actors and the migrant workers to tell about how to overcome this situation. I know that even Philippine Foreign Affairs, they did a FB live program with interaction with migrant workers to get their issues and a redressal mechanism they worked through FB. And after this situation of the first 2 weeks, 3 weeks, and you know that everyone was not able to move around, and the complete lockdown was imposed everywhere. And the next situation was to cover for providing when the airports were closed down, some people and the patients were asking for demanding to come back. And a very good example from Government of India did is to start a mission called Vande Bharat mission, maybe a big exercise after Iraqi Kuwait invasion. They declared a repatriation process through flight, ships, and other methods of transportation. Even 3 warships were allocated for a repatriation, bringing workers from Maldives and 2 other countries. 3 ships were allocated for warships were allocated for bringing workers from Maldives. And through Vande Bharat mission, around till today, almost 700,000 workers returned to India. But it was Kuwait repatriation. This was a paid repatriation. That time it was free for everyone. And Government of India's another good practice was actually, I identified that for the first time they asked their workers to register with a site called Swadis. The site is actually for registering themselves to about their job, their skill, and other things to a portal. And later government announced that they will utilize this data to for their repatriation and reintegration. Not repatriation, reintegration works, and maybe for the future jobs, both in the destination countries and India. So this was a good 2 steps initiated by Government of India. Similar steps were we saw from several Asian countries. Bangladesh also already started. Philippines have a mechanism already before COVID, because if any worker is going back or any worker is returning to home, they will take care of their wage and other issues. And Nepal also having a system to look into the wage and other issues of workers. But the major drawback we came across this situation is the workers who are leaving, who are coming after COVID pandemic were never given a chance to raise their issues. You all know that the COVID situation created a big issue of job cuts, wage cuts, and service benefits cuts, and lots of vulnerabilities to the undocumented and even documented workers. So the most affected workers, the blue collar workers, where several lost their job during the COVID. And these people, when their final thought was to reach back home only, they were never raised any issue of their wage cut or their other issues. But at least these governments, even the destination or their original countries, could have done something to look into their issues. But none of the countries were done a similar attempt to record their grievances. So finally, I just want to share, I just want to put a point here that the policies, the lack of policies for addressing certain issues were evident in all areas of COVID. Maybe we can say that it is new to them and new to origin countries also. But this issue of wage theft, or we were calling it non-payment or other wage issues so far, but the new term wage theft was actually happened during this COVID situation, was never addressed anywhere. And my partner, my home network, Migrant Forum Asia, and other partners are raising this campaign, a transitional justice mechanism to address the workers' issue, for remedies for the workers' issue. Is actually started recently, and campaign is going on. We were working on it, and we are seeing that this is the major challenge we came across this COVID pandemic. That's all for now. Maybe I can share a little more later.
Thank you, Mr. Rafiq, for that reflection, and also for just giving us a bit of an insight to the practical work that the Center for Indian Migrant Studies is doing in terms of safeguarding the rights of migrant workers. I think it was also very interesting to hear in the very last part there where you shared the work that you have done together with others in the campaign towards transnational justice for migrant workers, and also to listen to some of the practical the practices that are happening in other places. I think that there may be some questions coming your way. And then just turning to our audience, before I ask the panel, the other experts who are sitting in the room to just share their reflections, there is a Q&A tab of our Zoom. Please feel free to share some questions, because after we have heard from our experts in the room, we will now go to the floor and ask our panel of experts here to share feedback to the questions that you will ask. We also see some hands being raised. Thank you very much. It would be good if you could just type out your questions so that the presenters are prepared to just share their reflection, the answers to your questions just before we will close off with their reflections and the vote of thanks. So for now, I would just ask Dr. Pandey. Dr. Pandey, are you with us? And then I will ask Dr. Raj to just give us some reflections of the presentations that have been given so far. Dr. Raj or Dr. Pandey, anyone could go ahead. Dr. Sada, do we have Dr. Pandey in the room or Dr. Raj?
Dr. Pandey is there. Just Dr.
Okay,
Pandey, can you unmute you and speak?
Thank you.
I think she's not near the computer. Dr. Raj? I think she also
unmute. Okay. Can you hear me now?
Yes.
Okay. All right. If you can hear me, I will put my video also. Okay. I have a couple of, all the presentations are fantastic. I like this various global overview of how migration is being managed. What comes out very clearly is that there seems to be greater involvement, as is always the case when there is any catastrophe or the crisis, of the role of the NGOs, grassroots organizations, largely because of the humanitarian aspect in them, and they're close to the people, so they are more community-based, and the response is swifter, quicker than the response coming from institutions which have to set up certain policies and find some funds and so on. So I think this has become very clear that in this pandemic, the grassroots organizations are playing an important role, including in South Africa, where I just had some review of some of the work which has been done, that the grassroots organizations, a number of them in Johannesburg alone, have been actively involved through donations, in addition to the South Africa Solidarity Fund, which probably does not reach the migrants. Now, my concern is that while the local population is perhaps well served, the migrants and refugees and migrants who are stateless or statusless, they are left to the help that is coming from grassroots organizations. That is quite worrying. On the other hand, there are some encouraging signs that COVID is actually becoming an equalizer, bringing people together, that the pandemic does not make a difference between whether you're a citizen, non-citizen, or whether you're high class, low class, you're all in it. And therefore, by protecting each other, you're protecting yourself as well. So I think this has come out very clearly, and this is a good sign, the solidarity and so on. The third issue which the Senegalese colleague mentioned, the issue of the economy and the COVID, lockdown and the issue of the economy. The economy has to move so that people have some ways to take care of their needs. But on the other hand, The minute you open, there is this issue of the cases rising. Countries that have had fewer cases, like maybe Senegal, Dominica, my own, what we did during the lockdown was the informal sector markets, vegetable and fruit market, where a lot of people, farmers, they bring their produce. Those markets were open. What they did was they restricted the hours and restricted the number of people who could go there. But for Dominica, being a small place with very few COVID cases, or basically zero, it was possible for them to keep the economy going. And now recently they removed the lockdown. But these are very, very, very practical issues. When do we open? The economy has to go, but how do we contain? And therefore, the management of the management issue of COVID becomes very critical. And here I think governments in their policy have to have a total view that COVID assistance to support people during the COVID crisis should take a broader view rather than supporting their nationals. And I think in some places it is happening, whether it's the grassroots doing, or even in South Africa, I think they just turned a blind eye to and gave food rations to those who ever came. So I think this is very good, and perhaps ongoing research in other regions. I see Latin America is well covered in terms of managing a migration during the crisis. Asia is probably also. We have to do something with the islands, the Caribbean. The only good thing is because you have fewer cases and then people are not able to be crossing. There's no land border, it's always sea. So sea routes are closed, air routes are closed, and so on. So I will stop it there and say these have been very, 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 very informative and excellent presentations. And I thank the organizers for that as well, and the presenters. Thank you.
Dr. Raj, thank you. It's always a pleasure to hear your reflections. And I think it's difficult to even summarize after you, but I will still ask that maybe we can hear from Professor Dr. Mpande if she's in the room. Otherwise, Professor Bhatt. Professor Bhatt. Okay, Professor Maharaj. Professor Maharaj, are you able to share with us some of your reflections, sir?
Hello, can I? But yeah, right. I think we had a great hearing from all over the world, from Latin America to Africa to the Asian context. And when I think in terms of the South-South globe, I see quite a bit of positive issues that many countries have been able to deal with the pandemic COVID much better way, and perhaps the loss that we have suffered, despite all the disadvantages that we have, both in terms of infrastructure and a huge marginalized population in these countries. I think we have been better off. The case, particularly, I heard the Sri Lankan presentation. I was just wondering, it's the media has been often taking us to the stories which are exciting to the readers, but not taking us to the facts. This is one of the issues which face here in India too. Lots of such stories are there, glory in the media. But then when you look at the facts, I think even Sri Lanka has been, like India, has been better off in dealing with their endemic issues. So with this positive observation, I thought I pass on to Bridges there, I think, so we can take off. Thank you.
Thank you. I think you need to unmute your mic.
Yeah, thank you, Patty. And listen, it was a fascinating session. I agree with my previous colleagues. We've gone on a journey, and it's a South-South journey. That's very important. And I think I'm just going to throw in a comment because there are many young scholars in this listening. I think we need to do a lot more comparative research. And often our colleagues from the North come and do it for us and we help them. And there are barriers. There's issues linked to finance, but these days I think for a good project, you can get money. The other matter is the issue of language and how we communicate. And this is why the presentation on Latin America was very interesting. So we've got Portuguese and Spanish, and I've been there many times and often ask, why don't we translate this into a language that a lot of us can understand? And whether we like it or not, the language of science is English. So that's a political comment. But further political commentary is required if you're looking at responses. If you're looking at Brazil, which falls into the BRICS grouping, which is where South Africa comes in with a very small, we come under the small s actually, and India is in it and China. And of course, there's a big division in the BRICS arena on what's happening. And Sada, your GRFDT may want to consider bringing in a BRICS panel and to see where we may go. It'll be fascinating, I think. You can look at Brazil, and we know that the popular president has taken a line that's controversial, very much like Trump. And in fact, there's an argument that the popularists have taken positions that has exacerbated the spread of the virus. And you look at US, you look at UK, you look at Brazil, and you look at India. Now, I know I'm talking to a largely Indian audience, and whenever I make critical comments on India, I get threatened that by some elements in my own country that I won't get a visa to go back to India, but that must not stop our intellectual commentary. Then, of course, closer home, Dr. Faisal spoke about South Africa. That's the area, my location. I'm working on undocumented migrants and refugees. And yes, it's sad that in a country of Mandela, and we are celebrating the Mandela Month right now, we are saying there'll be nothing for refugees and undocumented migrants. What happened? The figures vary. It's very difficult to say how many, but at least 3 million undocumented migrants are in South Africa. What happens to them? They largely work in the informal economy, which is shut down. We know that. They can't go home because the borders are shut down, even if they want to go across illegally. Fortunately, a lot of NGOs, the churches, mosques, temples do come in. And yes, while the government is arguing that as policy, I think if I stand in a queue and ask for a food parcel, I'm likely to get it. So fascinating presentation. And I think that what comes out for me is the need, the potential, and the urgency for more comparative work from a South-South perspective. Thank you.
Thank you. I think indeed a journey through the South-South route, if we could call it that, and I think some very important lessons. And I would echo your message in terms of doing much more comparative studies, because there is a lot of opportunity for cross-learning in the different areas of migration governance, as well as migration management itself. I mean, we would be wrapping up, concluding, and I just thought that we could take on one question from the audience, because now all the questions have pumped up, and but I think we have had an opportunity for some of these questions to be addressed. The ones that were sort of asking what government approaches and responses have been. I think this session is being recorded, so if you've just joined in, you can hear it from the very beginning. To hear the different government responses. But maybe one important question that came from Amadou Ado Abubakar, who is wondering what the political implications will be for future bilateral and multilateral cooperation between member states. And here I will extend his question and see if I could ask, for instance, Amanda, if you could come in, that would be good for you to prepare that. And maybe most immediately, Dr. Marcia, if you are still available to just say one or two words. I know you are about to leave. If not, then I can pass it on to Leza.
Very briefly, thank you so much, Patty, and thanks to all the participants as well. Great to, hear the reflections of colleagues Amanda. That is great to find her again here, and Faisal as well for bringing the role of the local, but also Rafiq and Amantha, all of them great interventions. And to the less colleague as well for highlighting the relevance of cross-regional and exchange dialogue, particularly from the South. I particularly appreciate those comments, and I second as well. And I hope this is just the beginning of of a base of more cross-regional dialogue that we can have in the future. So thank you so much for the invitation. In relation to the political implication, it's a very good question. What we have seen in Latin America in particular, and Leisa highlighted this as a little bit in her presentation, is that there is a dialogue and some coordination in relation to the closure of borders. And they have been discussing as part of the PROSUR group when they're going to open the borders. But also we have seen a lot of bilateral exchange in relation of the reception of your own nationals. So for example, in the case of Chile, despite that the borders are closed, they have been open to receive their own nationals as well as their own residents. So even if it's a migrant with permanent residence in the country, they have been able to return, which has been different in the case of other countries like Peru and Peru and Bolivia, which closed the borders, and they were very concerned about bringing back their own nationals because there was an increased risk of COVID-19 virus. And there was a lot of bilateral negotiation between the countries there. Well, in the case of Chile, what they did is that they managed to secure that those migrants did a 14-day quarantine in the Chilean territory before the other government allowed them to cross back. So we see increased negotiations bilaterally and regionally as well. I think the question that we have, particularly in the question of migration, is how this closure of borders that we have accepted as part of the response to the pandemic is going to shape migration governance in the future. Particularly in the context, as Leisa highlighted, we have an increase in intra-regional mobility. So some critics says that despite that we accept as a rational option that the borders are closed, the borders closed quite late anyway. In most of Latin American countries, it happened in mid-March. So really didn't stop necessarily the massive spread of the virus. And we might see an increase of irregular migration. And then we will have to see what the responses is. We have seen this in Europe and in other parts of the world as well, that there's an emphasis in battling trafficking and smuggling, but really we don't address the root reasons of why we have this type of irregular crossing, and that relates to border closures. So I see that in the context of Latin America, we have seen a political shift in the last few years that have changed the levels of regional cooperation and has strengthened in a way this aim of promoting economic cooperation, not necessarily those based on more human rights-based issues. But we understand that this is a concern for the entire region, and migration is going to continue. So it's expected to see that in the future, bilateral negotiations, but more regional approach to migration management is going to still continue in the context of Latin America for sure. Patty, I'm afraid that I have to go because I have another talk, so I apologize, but thank you so much for everybody for joining us today.
We are privileged that you could be with us, and thank you very much for your time. I would just ask then Amanda to zoom in there on the West African front while I prepare the next question that I will ask the other two presenters. Amanda, are you with us to give us a bit of perspective in terms of looking forward?
Okay, can you hear me?
Yes, we can. Perfect.
Great. So it's an interesting question. Increasingly, what we're seeing in West Africa is a lot of social unrest, and it can be linked to the pandemic exacerbating some of the challenges that were already within these societies. And so the political dynamic already, we're seeing it play out strongly in the region. A case in point, of course, is Mali, which is going through a lot of discussions and a lot of challenges right now. And ECOWAS has stepped in and is trying to, as much as possible, resolve the challenges that the government is facing with the citizens, the face-off between the government and the citizens. Now, of course, there is that implication, and then increasingly we're seeing room for bilateral cooperation. So while in the region, most countries locked down their borders and the free movement was completely stalled. The implementation of free movement protocols was completely halted. We still saw that between some countries, movement was still going on. So, for example, between Cote d'Ivoire and Burkina Faso, you still had some sort of movement going on. This is a very important transit and trade corridor for the region. So bilateral cooperation in the face of reducing regional cooperation, we see is still very important. And also for neighboring countries to be able to combat the virus or to be able to respond appropriately, bilateral cooperation is very important. In terms of cooperation also between the region and other regions. Marcia made mention of Europe and what's going on, and of course the key region for West Africa, when we talk about migration management, is always the focus of Europe on irregular migration. It's been interesting to see that the pandemic has not in any way stopped irregular migrant flows from West Africa. Rather, what we see is that there is a reduction in the number of people that are moving through irregular channels, and however, they're also moving through more dangerous channels, and we see an increase in the number of deaths that have been recorded during this time period in the Mediterranean as opposed to this time period for other years. So that's quite interesting when we look at multilateral cooperation in terms of migration cooperation in that sense. I mean, looking at the focus on irregular migration and what can actually be done to stem it. I mean, the focus on stemming irregular migration, I guess this shows us that probably we're placing the emphasis in the wrong place. Given the restrictions and how people are still able to move, in spite of these restrictions, then it means that we should, in terms of migration management, look at other solutions and not just the increased emphasis on curtailing or stemming irregular migration flows. I think another thing that will be interesting moving forward in terms of both bilateral and multilateral cooperation is looking at labor mobility and how the pandemic has revealed to us the issues around skilled migrants, unskilled migrants, the opportunities available for labor mobility, and the available skill set of migrants in West Africa, especially looking at this window between this migration corridor between West Africa and Europe, the available skill sets of migrants in West Africa, the available opportunities in Europe. Should we be doing something else when we're looking at labor mobility options in designing labor mobility schemes between European and West African countries? Should we just be focusing on the sectors that they're focused on now, which is mostly IT and tourism, or should we extend it to other sectors also? Quite interesting things, I think, that the pandemic has churned up, and I hope moving forward we'll be able to deal with them in a positive way and not just focus on the xenophobia and the nationalistic feelings that we see increasing.
Exactly, that we do have, we do have a lot of advantages and benefits to look at here, and I like the way you ended that, Amanda. And I'm wondering if I could just look at Leza and Faizo as I ask the next question, which is sort of asking what the proactive role would be played by local governments. Do we think that this would bring a change in the governance models? So this is sort of a bit of a reflective question, looking at the way things have happened and the role that the local governments have played so far. Do we see that changing in terms of the structures, in terms of the processes and whatever we have under the governance models in the different regions that you cover? And then I will have a last question for Amantha and Rafik. Leza, you want to start us off?
Pardon?
Go ahead, thank you.
Well, unfortunately, I'm not the expert on local governments. Marcia is the one. I'm the expert in international relations. So, yeah, can I talk about international relations? So
yes, you can. Yes, you can.
At the regional level, I have mentioned that there are some good practices that we can mention that have been taken at the regional level that affect the national one. For instance, one of them, I've mentioned it, is the one of binational cities. So that is a very good practice, as in South America, there is a historical pattern of migration, which is border migration. This has been there forever, even before there were nation states as themselves, even before the Spanish colony and Portuguese colony. People have migration within the region, and that stays until today. So that's why we have binational cities. And regional cooperation right now is helping quite a lot to manage these binational spaces and transport the daily migration. Also at the regional level, what we can see, well, going from the international and going down, go that like top-down approach. Right now, what we have nowadays is, well, we can see this globally, is fragmented multilateralism and minilateralism instead. So proliferating. So I rather see this tendency even deepening. So what I want to say with this is that we may have other forms of cooperation, of international cooperation, proliferating very specific ad hoc subjects. For instance, migration, but even more specific types of mobility and agreements on very, very specific topics, most of them very likely to be cooperation and not binding types of agreements. That's what I foresee. And in the case of South America, this can be seen in the types of cooperation that have been proliferating in the last few years. So Prosur, the fragmentation of UNASUR and the proliferation of Prosur, which is a much more fragile, if we want to say, type of cooperation, which only focuses on very general issues and doesn't really create regional shared policies as UNASUR used to do. So it's much more of a ad hoc type of cooperation. So we may see that type of cooperation proliferating right now. Yeah, I think that's it. And I really wanted to say that I really appreciated all the cross comments that you made about your regions and your countries in the Global South and the Global South perspective that we gave to this conference. I very much appreciated it, and thank you very much to all the colleagues.
Thank you, Leza, for that reflection, and I did think that that was where I was actually going to. This concept of the binational cities for me sounds something that's very interesting, that could obviously be replicated if there was more political will, obviously, in the different between the different countries of concern in different regions of the world. I wondered if we have Dr. Faizo with us, just to give us his take on the southern side of the African continent on the same question. Dr. Faizo, are you still with us?
Yes,
Okay.
I'm still.
All right.
So I think, you see, states do not things because it makes sense to do so. I think you need a certain level of popular mobilization in order to effect this. So what we've seen is the effectiveness of grassroots intervention that is able to force local government to do particular things. Now, these things happen because people were mobilized. You see, these things happen because the question of how our mortality has become a reality in front of us, given COVID, became a topical issue. You see, so I think one reality that we will face is increasing xenophobia from the top, because COVID, I don't think, is about to go away anytime soon, and states would have to provide social services their inability to provide that will lead them to seek scapegoats. Migrants eventually will be scapegoated. So a counter movement against that would be the opening for a form of real decentralization around concrete issues of community building, of political communities, of livelihood. So I think it's really about politics, that question about, and that's why the issue of what is the purpose of research, and is it research for its own sake or research for social intervention becomes important here. And finally, I also want to say thank you very much for the opportunity and the invitation. I completely agree with suggesting about comparative South-South research. One of my most memorable fieldwork experience was in a place called INA Market, or the African Market in Delhi. I still remember working in that place with African migrants in India. So I think it's really important, because often the issues that we look at in our context become illuminated, in other parts of the global South, given the commonality of our historical trajectories, but also socioeconomic similarities. So thank you very much.
Thank you, Dr. Faisal. Amantha, any reflections that you can give us, and this is a tricky one, and I hope I won't take you into essay mode, that can give us on sort of, so the question is asking around the major roles of the Commission of Human Rights in every country to resolve migrant issues. What would you think would be some of the major roles looking forward? And in here, I would also ask to add your 2 key points from what you have, from your viewpoint.
Well, I mean, I'll go back to where I ended my small presentation, which is the role media, and now increasingly the role that social media plays in a context like this. Now, the situation where the Sri Lankan migrant workers are right now, why they face this kind of resentment in their own country is partly and probably mostly because of the narrative that's been set by default by the media not looking at important issues. And into this comes social media, which kind of spews all kinds of information, disinformation, and misinformation into this. And my hope is that a rich resource like this webinar, the resource pool of this webinar, if there are measures that these resources can be channeled into the public at large, that there will be a greater understanding and a greater empathy to the migrant workers rather than looking at them in dollar signs, which is what's happening in my home country right now. And once again, thank you for inviting me to this. It's been a great pleasure.
Thank you, Amantha, for that. Rafiq, do you have any reflections that you can share with us from your perspective and your 2 key points?
Yeah, maybe I can see answer for the 2 questions you raised before. One is multilateral. I think, can you hear me? Hello.
Yes, we can hear. We can hear.
Okay, the question one of the participants raised is what will be the future of bilateral and multilateral cooperation between member states. From the region, Asian region, I can say that it's going to be very problematic in the coming days, because already some states in Gulf declared that they are going to cut short the numbers of some countries, and they're going before some quota system. That means it's going to be badly affect to Indian workers, because everywhere, every part of GCC, Indians are the largest, and out of that, maybe Malayalis, Kerala will be the #1 in each state, each country. So this is going to be definitely affected, because the future, actually they developed this strategy not only because of COVID, the situation, the world economic crisis, and the other situation, the localization, the unemployment among youth. This all issues actually was on shelf when COVID was actually it came in between that issues only. So it all triggered to one point that anyway the workforce will be reduced, and even with the limited workforce, there will be very limited chance of getting protection and equality for with the local workers. The kind of there will be big disparities between local and a foreign worker. This is the same for the second question. National Human Rights Commissions in the whole part of this region actually was not, done nothing with regard to the welfare of the workers. I raised a big issue during my talk, that about the wage theft and wage issues against workers were very visible everywhere, because even the government policy was supporting the employees at one stage that there is no issue of cut shorting their working time, cut short their wages, cut short their benefits. Kind of policies were declared during this COVID time, and it was actually implemented in several areas, and it was badly affected several people. From my state, we have around 90,000 workers, job loss workers came back, and the government of India is not having a figure like this. Government of India started a repatriation process. You can see the link for repatriation in each of the missions, embassies website, but there is not mentioning anything about the workers' status, workers' wages, or workers' any other issues to record their issues in that particular document. So things are going like this, and even the sending and the destination country government is reluctant to hear of the issues of workers. Even the human rights mechanism and the bilateral mechanism, as you all know, that our region, the SAARC, the ADD, and the Colombo process. The SAARC and the Colombo process is the two platforms for the sending origin country government, sending country government, worker sending country governments to speak about the workers' issues. And they, for the last Kathmandu declaration also, we raised several things, but it was never reflecting, it was never echoing in the other platforms like ADD. And SAARC is no more for last 2 years. Because of India's dominance and India's reluctance to join with Pakistan, there is no way for sitting together and making a collective bargaining to the employees of the destination country governments. So there is we are seeing a shrinking spaces for the workers, shrinking spaces for the rights, and shrinking spaces for the rights of the migrant workers. That is for now. Thank you.
Thank you very much. We do have a lot of questions that have been asked in the Q&A. And unfortunately, our experts and also the audience, after 2 hours of sitting and listening, I think it has been a long time. We've taken on a lot. I think it's even difficult to summarize, but in a few points, I would just like to highlight some of the things that have been presented, talking about a bottom-up approach. That's been very important in looking at solidarity that has been evident among migrants and host communities, and seeing how that can be emulated at local and national levels. Talking about flexibility in crisis that communities have been able to show. And these examples have been taken from many places in Latin America, in South Africa as well. We heard about some exemplary ways that this has been done. Talking about regional mechanisms and how those that have worked and how those could trickle down as well. We have an opportunity in what we're calling the new normal, understanding how border migration can be handled better. Should we have more binational cities? That's probably something that we could explore in our cross-learning platforms. Looking at increased negotiation around migration management for returns, looking at the cases that are happening, not just for India, India getting its migrants back from from the Gulf region, but also understanding the Venezuela crisis and how that has worked out, and seeing that when people feel that they are desperate and they're not treated very well, they will even go back to a worse situation. I think this is what the Venezuela crisis is trying to bring out. But how can we be better at negotiating that and looking at it from a migrant's perspective? There's room for bilateral cooperation in managing interregional movements, definitely much more room, and I think we could be doing much more than that. And I guess one of the most important things is that migration will not stop. In fact, what's happening is that it is being diverted and it is dangerous. And so before we lose many more people that are using more irregular means to get across, to reach their dreams and ambitions, and sometimes to just get to a safe place for their livelihoods, I think a forum like this has the task with our skills, our experience, and our professional knowledge to move things to the next level. And I think that's a very big responsibility that has been put on the forum to try and steer this process forward. We don't know what format that would be, but I think we all stand and look forward to it as it would be an interesting place, since this is the Global Research Forum on Diaspora and Transnationalism. Without much further ado, just to say thank you to this audience. It has been a room with 200 plus people that have participated actively. Thank you to the panelists. I would just ask Dr. Monica Bisht to come and give us a vote of thanks.
Thank you, Patty. Thank you, Patty.
You're welcome. Go ahead.
Correct.
Dear speakers and participants, on behalf of the GRFDT, I am Monica Bishtranjan, delighted to give a vote of thanks. It is challenging for me to express sincere thanks in few words, but I take this opportunity to pay my wholehearted thanks to Dr. Marcia Vera Espinoza, Dr. Lisa Brumet, Dr. Faisal M. Garba, Mr. Amantha Pereira, Ms. Amantha Bisom, and Mr. Rafiq Ravithar for sharing their knowledge and information with all of us. Respected speakers, your knowledge, your ideas have really enriched the dynamics of today's discussion on migration management. It is my privilege to thank Ms. Patty Sianga Kudnesen for moderating this panel discussion very well. Ma'am, you have moderated this virtual discussion with so organized, timely, and effective way. I must appreciate it and give you best wishes from GRFDT. Thank you for always providing your consistent support to us. I also like to thank all the participants, especially Professor Brij Maharaj, Professor Binod Khadaria, Professor C.S. Bhatt, Professor Andrew Geddes, Professor Pushpendra Kumar, Professor Dr. Raj Bordile, Mr. Celio Dione, and Mr. William Goes for your illustrated presence and participation in this webinar. My apologies if I have mentioned any of your names incorrectly here. I extend my wholehearted thanks to all the researchers and students from India and abroad who have participated in today's webinar, and many of you have participated in our webinar series since the beginning. We are honored by receiving positive and encouraging responses regarding our webinar series. So thank you so much. Last but not least, I extend my thanks to the organizers, especially the management and support team, for their regular assistance, smooth communication channel, as well as providing timely information in several social media platforms. Now let me inform you about our next virtual seminar. The tentative theme of the next virtual seminar is High Skilled Migration, Perspectives from Latin America, Africa, and Asia. All the details and information will be provided to you in a couple of days. So we request you to kindly join us and participate in our next virtual seminar again. Till then, goodbye. Have a nice day. Thank you.
Thank you all. I must say Amantha and others who have been, now I think it's 2 o'clock in Australia. He's still there. So it is a great, punishment for you. But thank you so much for agreeing at last moment. And all of you, such a pleasure to have you. And goodbye. We'll see again and again. This is the forum we want to keep continuing this conversation. We'll meet again. Thank you.
Thank you, Dr. Sada.
Thank you.
Thank you, everyone.